Good evening, everyone. Thank you for taking time out of your day to join us this evening. My name is Brenda Moynihan, and I'm the Director of Marketing and Outreach at the Kensington Assisted Living Residence, and I'm very honored to welcome you to today's webinar. Tonight's presentation is How to Mitigate the Effects and Lower Your Risk of Alzheimer's Disease. Part 2, Supplements, Medication, Stress Management, Socialization, and Coping Strategies. During this presentation tonight, we will hear the latest news on supplements, caregiver stress, and the power of socialization. We will also hear from a national Alzheimer's early stage advisor and her care partner on living day to day with Alzheimer's disease. Before I introduce our speakers, I'd like to briefly give you some information about the Kensington for those of you who are not familiar with us. The Kensington is an assisted living, and we're located in White Plains, New York. We are committed to providing outstanding care every day with a full spectrum of clinical support, including caring for those with Alzheimer's and additional dementias. We encourage independence and confidence and focus on making each individual feel important. Our promise is to love and care for your family like we do our own. If you would like information about the Kensington and ways we can assist you, please feel free to contact us at 914-390-0080 or go to our website at www.thekensingtonwhiteplains.com. There will be a Q&A at the end of the presentation, so please feel free to type in your questions in the chat box or the Q&A box in Zoom, either located at the top of your screen or the bottom. Also, all attendees will receive a post-event email containing information on our speakers. And please join me in welcoming our speakers for this evening. Jason Cohen. Dr. Cohen is a board-certified neurologist. He is an assistant professor of neurology at Montefiore Medical Center and the Albert Einstein College of Medicine in the Bronx. He attended medical school at the Mount Sinai School of Medicine, then moved to Montefiore, where he completed his internship, residency in adult neurology, and a fellowship in geriatric neurology. He is now based at Montefiore's Multidisciplinary Center for the Aging Brain and is part of a team working to diagnose and manage cognitive decline in older adults. He is an educator and teacher of neurology and psychiatry trainees, medical students and physicians, and other health professionals from various specialties about dementia. Our next presenter, Eva Ruskowski. Eva is currently the Engagement Manager and Young Professionals Alzheimer's Council Advisor at the Hudson Valley, New York chapter of the Alzheimer's Association. She is responsible for developing networks in raising awareness and funds and reaching community leaders, families, and health and social service professionals. Eva has a background in youth development and writing and acquired her master's degree in organizational change management from the New School. And our also presenters for this evening are Tammy and Paul Maida. Tammy is a 2020 National Advisors Early Stage Advisor, and Paul, her husband, is her care partner. Welcome, everyone. Welcome, Dr. Cohen. I know he's here. I can see him, folks.
Hello. And screen is shared?
Sure.
So, hi everyone. First, thank you so much, Brenda and everyone at the Kensington for inviting me, and Ava, I'm very honored to be here. Today I wanted to talk to you about lowering the risk of Alzheimer's, supplements, stress, and also future medications. I don't have any financial disclosures, so you know nothing that I'm going to be talking about is FDA approved, and these are general recommendations. So if you have specific questions, talk to your doctor about how the things that I say might or might not apply to you. The things that we talked about last time is making sure that we're giving people the best advice possible, making sure we have an accurate diagnosis, and we have the best possible research studies. We talked about using diet and healthful diet to lower the risk of Alzheimer's. No one particular food, berry, bean, other, but generally healthy diet, whether it's Mediterranean, mind, other. Using exercise to lower the risk of Alzheimer's, and controlling health risk factors, so making sure cholesterol, diabetes, blood pressure are under control, avoiding smoking, or if you can't stop smoking, at least to lower the amount of smoking to lower the risk of Alzheimer's. Today, again, talking about supplements, future treatments, and then a little bit about stress. So supplements, where do we stand now? Right now, there are three main types of supplements for lowering the risk of Alzheimer's. There are the things that look really good or sound good, but we haven't proven yet. There are the things that are promising in theory, or sorry, not promising in theory and also not proven. And then there are the things that we tried to test and just unfortunately failed and turns out don't work or don't work at all. So you say, well, why not just take them, right? Well, what's the harm? Well, unfortunately there are. So there are harms to the specific person who takes some of these supplements, and there are harms to society also, but to the specific person. So sometimes the actual ingredient in the pill, it can be toxic, especially because the amount that's listed on the label often doesn't match the amount that's in the pill. Supplements in this country aren't really regulated, very minimal regulation. So many times when people test the amount that's actually in the pills, it's not the amount that's listed on the label. And if you get the amount wrong, even a chemical that works can be toxic and cause side effects. There are all of the other stuff that's thrown into the pill that maybe you don't know about, but some of the supplements out there have steroids in them accidentally. Caffeine. I feel great when I take my memory supplement because I just had 2 cups of coffee and I didn't know about it. Or some other chemicals that have actually been banned in this country around the world for side effects. Also, to keep in mind that anything that can help, even if it's something that doesn't have any unlisted ingredients, even if the chemical is not toxic, the ingredients are right. Right? There's no such thing as something that's only good without the bad. So anything that you say, yes, this can help my memory. Well, anything that is changing our brain chemistry, anything that's changing our body also has the potential to have a side effect. And for things that we've studied, we have a better idea of what those are. But there's no such thing as good without the bad. So always something to keep in mind. If it's not something that we've studied as well, we might not know if it's safe when it's combined with other medications, or even if it's something we have studied, if there are other ingredients in there, we don't always know what's safe or not safe in combination. Sometimes I have heard, well, they don't want you to know about my miracle medication. Whenever I hear that, I think, well, I'm sorry, but someone's trying to make money off of you, right? No, I really want people to know about absolutely everything I have to offer about lowering my risk, or lowering your risk rather, of Alzheimer's and other dementias. And some of them, unfortunately, some people are able to scare others away from getting other treatments, right? Not getting their high blood pressure treated, not getting their cholesterol treated, not taking medicines that even if we know are not perfect, but are not interested or amenable to the things that we know work, even with their limitations. So I'm always a little bit skeptical. No, I really want you to know. And then there are the financial costs, right? So depending on the supplement, $20 a month, $100 a month more on things that you could probably spend that money on better uses. Right, and then there are the harms to everyone. So Americans spend, and these numbers are a couple of years old, about $35 billion per year on supplements. Well, if I took 35 billion and split that up to everyone in America with Alzheimer's disease and their families, everyone would get $5,645.16. I don't know. I could do a lot of good to help people with that much money. So I always try to think about the individual person, but also as a society that, we want to make sure that we're helping everyone and we're investing our money and our time wisely. That being said, some specific supplements, so some examples. Well, vitamin E originally looked more promising. It turns out that high doses might increase your risk of bleeding into your brain. Ginkgo has been taken for thousands of years. It was tested. It was actually tested in a pretty well done research study, and it failed. Prevagen, well, the company that makes Prevagen has lost a number of lawsuits. So if they took your money, you might actually be able to get some of it back, because they're not allowed to advertise that it actually helps your memory, other than it might support smiling actors looking at you looking good. So I'm waiting to see, right? There are a lot of things that we haven't tested yet that might sound promising. So far, when people have tried to study fish oil, doesn't seem to do anything. Eating actual fish, though, there's increasing evidence. We've had an increasing number of research studies that eating real fish, eating real food, seems to work and seems to actually lower your risk of getting Alzheimer's or other kinds of memory loss. But unfortunately, at least so far, trying to squeeze a fish into a pill doesn't work. Curcumin, for right now, I'd say put the cumin in your cooking, but I don't know if I would take a pill. Resveratrol, I drink a glass of red wine, but I'd skip the pill for now. Hopefully in the future we find more, but again, right now we don't have enough to really recommend them. And unfortunately, we know that some supplements out there really do cause harm. Supplements that do work. So people who have specific vitamin deficiencies, specific medical conditions, vitamins are amazing. They're invaluable. Prenatal vitamins, folic acid, for the right person, B1, B6, B12. Last I checked, most people weren't getting scurvy and sailing across the Atlantic Ocean in the 1700s. So unfortunately, vitamin C doesn't do much. But the nice thing is our bodies pee it out if you take too much. So I'm generally not too worried if you take it, but it's not helping you. It's not helping you prevent COVID either, unfortunately. Vitamin D, lots of people are deficient, especially if we're around New York. So if you don't have enough in your body, vitamins really do work, and certain people it really does. The nice thing is most people don't need these, and for some, your doctor can check. So vitamins that you don't need don't do much. But really, how do we know, right? I want a vitamin to work. I was part of a vitamin study a couple of years ago. I would love to find it. We keep looking. We know by doing research studies. We know by trying to test it, and to test not knowing what the answer is going to be ahead of time, not having a financial interest in the outcome, and hopefully we find something. Finding studies is easy, so going to a group like the Alzheimer's Association Trial Match. I typed in my address in Yonkers, my office address, Alzheimer's within 10 miles, got 42 trials, and it was like 50 something seconds. And so the research studies are out there if you're interested, and that's really how we know what information to give people. And this way, if something works, then I have confidence to say, yes, I know that having a healthful diet really works, and here's the evidence, and it's worth your time and effort to do this. Future treatments. So we keep looking for newer, better, and greater treatments for Alzheimer's disease and other dementias. As of last year, there were 136 big research studies. And for those, we needed 31,000 people. Because in order to really know if something works, I can't test it on 2 people, right? Testing in 2 people gets my interest, but if I want to know, I have to test it in a large number. And we want to be able to have confidence. We want to know if something has side effects. We want to know, because every person is different. I want to know who this works for and who it doesn't. Don't worry, there's no quiz on this, but the landscape has changed amazingly in the last couple of years. We now have so many different medications and chemicals targeting so many different parts of the brain and the biology. And I'm very hopeful that in the coming years, we do have more better treatments that are more and more effective over time. We have some that are in phase 3, or called the closest to being ready for prime time, and looking at attacking this disease from all sorts of different angles. Some of it is refining what we have. So if we can find a supplement, a vitamin that we know about that's safe, that would be amazing. Can I improve my treatments for diabetes or blood pressure? How much mental exercise how much physical activity works? How do I prevent head injuries? How do I reduce pollution? So some of the research is improving what we already have. Some of it is the future. You're going to be hearing a lot more about anti-amyloid. Amyloid is this protein that gets stuck, that gets cut up and packaged into this little ball that get stuck between our brain cells in Alzheimer's. And where people are across the country and across the world are working on medications that either reduce how much is in the brain or tries to get it out of the brain. Many have been tried, most have failed or failed miserably, honestly. But there's a new medication that the FDA is going to decide on this summer. My not so humble opinion, I don't think there's enough evidence. Again, I'm always a little bit skeptical when someone's trying to sell me something. I hope it works, but I need to have it proven to me, but we're going to find out. Tau is this other main protein, this main thing in people's brains with Alzheimer's that seems to be a big target. There's a vaccine that is going to hopefully be tested again soon. It did pretty well so far in the trials, but there are a number of medications and techniques that are going to be studied. Just at Montefiore Einstein right now, we're testing, is dancing better than walking, right? Are different types of physical activity combined with mental activity more helpful? Can I give you a computer game? Can the vitamin study I talked about, can I use an existing diabetes medicine to change the aging process? Can I use tiny electric currents across your brain? Can we get better pictures of the brain to diagnose people more easily? So a lot of these are in process, but again, we need everyone's help, because together, hopefully we can, get better diagnoses and better treatments. And then the last part that I wanted to talk about is stress and Alzheimer's. So really short-term stress is helpful, right? If you're being chased by a bear, you want to be able to run a little bit faster. Honestly, you're not outrunning a bear. Bears run at 30 plus miles an hour. But short-term stress can help. Long-term, though, we know stress does bad things to our bodies and to our brains. And unfortunately, caring for someone with dementia, especially Alzheimer's, even compared to caring for someone with a different kind of a medical illness, leads to a lot higher rates of physical, emotional, and financial hardship. And caregivers who are under stress, it really affects our entire bodies. It affects our lives. You have worse immune function. You're more likely to get the flu or a cold. You have higher rates of heart disease, kidney problems, higher rates of depression and anxiety, higher chance of needing to go to the emergency room, getting hospitalized, higher rates of getting dementia yourself, and even a higher risk of dying compared to a caregiver who's not under stress. And then beyond you, so when I tell people in my office, well, okay, so these are my recommendations for your loved one who has dementia, but how do we care for you, right? How do we make sure that you as the caregiver are getting taken care of and we reduce your stress? It's not just being nice, like we have to take care of you so I don't see you in the office in 10 years, because I want to lower your risk of all of these bad things. But the patient, the person who has dementia, if your caregiver is under stress, you're more likely to get worse care. Neglect and abuse, but also just all cause worse care. It's harder to give high quality care if you're under stress. If you have dementia and your caregiver is under stress, even if I take into account your age, how bad your symptoms are, even if I take into account your caregiver's health, all of the above, you have almost a 50% higher chance of dying compared to someone with the same dementia whose caregiver is not under stress. So as stressful as those slides might make you, it's not a lost cause. So helping symptoms lowers stress. Medications, non-medication management, getting help from a team lowers stress. Education lowers stress. Caregiver support lowers stress. A group like the Alzheimer's Association, sorry, they put an apostrophe on their name, Alzheimer's Association for them, sorry. They have a 24/7 helpline, really 3 in the morning, call even our colleagues. They are amazing. They've got support groups, educational resources. In the 5 boroughs, we've got Caring Kind in Westchester Jewish Community Services. So many of these groups are wonderful, great resources to lower your stress, help you take care of yourselves, help you take care of your loved ones. And I cannot overemphasize how important it is to take care of ourselves so we can take care of our loved ones. So I talked a little bit about supplements. I talked a little bit about the future treatment of Alzheimer's, and I talked a little bit about the importance of stress. So thank you again to the Kensington, Brenda, and New York State for letting us do what we do, and my colleagues at Montefiore who let us take care of patients. So thank you.
Sure. Thank you so much, Dr. Cohen. Thank you. Eva?
Hi.
Hi.
Hello, you can see me. Okay, this is great. And I am waiting for my slides. Perfect. Thank you so much, Chris. Okay, so first of all, I'm so happy to be here. So thank you, Dr. Cohen, and thank you, Brenda and the Kensington for having me today. And so to add to the conversation about stress, I wanted to highlight the importance of asking for help in order to prevent burnout, specifically for caregivers and care partners. And I speak about this from the heart as I am a caregiver for my father. I've been a caregiver for him for the last 11 years. So I definitely speak about this from the heart because I've experienced burnout and stress as a caregiver. And displayed here is a snapshot of who can serve as a care team for care partners and their loved ones. And a care team is essentially your support system, which can very well help mitigate stress. So families typically look to their primary care doctors to help with making medical plans, and other medical professionals who specialize in the area of dementia care may also be included, especially during the process of making a diagnosis. But once the diagnosis is made, find out who will coordinate care on an ongoing basis, because that is going to be your medical team. But your care team in general does not stop there. Peers can be a tremendous support to the core care team members. As the disease progresses and care needs increase, friends can really offer much needed breaks and emotional support. So keep in mind that your peers are very important. Additionally, there are often services available through your workplace. So everyone who is working and who is a member of the care team should contact their company's human resources department or employee assistance program to ask about caregiving benefits. Families can then look at their pool of resources and make decisions about how to proceed. And there are also community resources available where you work and live. Some are even online so that your entire family can have access to information and support. And I can't emphasize this enough, but please, to lower your stress, make sure that you are in fact reaching out for help, because nobody can do this alone. Consider also your faith community, as well as community programming that is local to you. And these resources as a whole can offer some respite. And this actually leads me to our next topic, which is the topic of social engagement. Social engagement can provide respite and allows an opportunity for you to connect to people who are going through the same thing. Chris, next slide, please. So based on research, I'm sorry, I don't see the slide advance. There it is. Thank you. Sorry, must have been a delay on my end. So based on research, it is now accepted that social interaction is a potential protective factor to cognitive decline. Much research is still being done about this, but we have seen that connecting with others may benefit brain health, along with reduced rates of mortality and disability. As we have seen recently with COVID, isolation has had a negative effect on many people. But I would like to be clear that there is the least amount of research in this area when it comes to reducing your risk of cognitive decline. But what we do know is that isolation is not good for any of us because we are social beings. Researchers aren't sure why, how, or if social networks may help keep the brain resilient against Alzheimer's disease. But cognitive reserve is a term that we use for something in your brain that wards off symptoms of Alzheimer's disease. And some studies suggest that cognitive reserve may be developed and maintained through higher levels of social engagement. And this has really sparked the big conversation around the impact of the benefits of socialization. Also, when people feel good about their social networks, they tend to make healthier choices in other areas of their lives and also report lower rates of certain comorbidities. So there are a variety of ways that you can connect to the people around you, and we're going to look at that in the next slide. So first and foremost, choose a way that is meaningful to you. Try to choose an activity that has a cognitive and a physical component. Get together safely with friends and family, or learn a new skill. These will all be beneficial to your cognition. And on this slide, you'll see some ideas. Some of these are difficult during a pandemic, so definitely think of the safest way to do these activities, whether they're virtual or in person. But definitely staying connected with family and friends is one way that you could remain socially active. You can meet new friends and form new friendships, especially through Zoom opportunities such as webinars. You can be active in your community, and this is why community centers are so important. They give us an opportunity to stay social and to stay connected to each other as we age. Volunteer at your local library or even with the Alzheimer's Association, and I'll present some options later in my presentation about how you can volunteer directly with us. You can also take classes virtually or in person when permitted by state guidelines. Of course, as I mentioned, we have to make sure that we are staying safe while staying socially connected. You can also join a local walking club or book club, and sometimes activity clubs really help us to get to know other people because that's where you find people who are like-minded and have the same interests as you do. Next slide, please. So if you care for a person with a type of dementia, you may take part in some of the social enrichment activities that the Alzheimer's Association provides. We are in communities across the country, providing direct service to individuals and families who are facing the disease. We also have virtual engagement activities for caregivers and their loved ones with dementia. The Memory Cafe is once a week on Thursdays, and the Tuesday Social is once a month. The format is similar for both, mostly music or some sort of similar activity. We also have something for alls on Fridays, and that's a group for persons with dementia and their loved ones to participate in creative arts activities together. And it's really an opportunity to shift gears, to participate in something together. Really, we have ongoing programming through the year, and you can call our 1-800 number to learn more, and it's right there on the screen. It's 1-800-272-3900. That's our 24-hour helpline. We are holding all of our support groups and educational programming virtually at this time, and that has not been paused at all during this pandemic. So if you know of any care partners or caregivers who can benefit from support groups and education, please direct them to us. As you see, we also have online resources on alz.org. I already mentioned the 24-hour helpline. We offer one-on-one care planning meetings with master's level social workers. Lots of services for you to take advantage of if you've been impacted by Alzheimer's in some way. Next slide, please. So additionally, continue to take advantage of dementia education, which helps challenge you cognitively, and that's always a good thing. We have our research forum on May 11th, so you can join us for an informal discussion with Alzheimer's experts, caregivers, and elected officials, followed by an educational program on COVID-19 and caregiving. And on May 12th, the Young Professionals Alzheimer's Council, which is our junior board here in the Hudson Valley, is hosting our first ever rare dementia panel discussion. We have an excellent expert panel lined up to discuss less commonly talked about dementias. And Dr. Cohen, who you heard from earlier, will also be on this panel. And there are also many other educational programs our chapter has been working on. So you can always call us to learn more about that. Next slide, please. And if you want to volunteer, which is also a suggestion for social engagement from the previous slide, here's a snapshot of everything you can do with the association. You can take part in our Walk to End Alzheimer's, which will actually be taking place in person this year at SUNY Purchase on October 3rd. There will be a virtual component for individuals who are unable to join in person. You can also create your own fundraising activity for the longest day. You can get involved in advocacy. You can become a trained program volunteer and become a community educator or a faith representative. And in terms of research, you could set up an online profile on Trial Match, which Dr. Cohen talked about. And that's a clinical trial matching service that connects you to research trials that are in your area. So again, lots of ways to get involved and be social, whether it's virtual or in person. Next slide, please. So thank you again for joining me today. Please remember that the Alzheimer's Association 24-hour helpline is always available to personal and professional care partners and caregivers for resources, information, and support. And I think I'm up to my final slide now, and I would actually like to introduce our next speakers, Tammy Maida and her husband, Paul, and care partner. They live in San Jose, California. In 2019, after nearly a decade of testing to try and discover the causes of her cognitive symptoms, Tammy was diagnosed with early onset Alzheimer's disease at age 62. Tammy is a member of the Alzheimer's Association 2021 Early Stage Advisory Group, through which she shares her passion about providing hope for those living with an Alzheimer's diagnosis. Please welcome Tammy and Paul.
Thank you. Thank you for having us.
Nice to meet you all.
Yeah, it's nice to be here. I think one of the first things I'd like to say is that this disease is real. It affects not just myself, but it's affecting our entire family. So I think it's a family effort to want to get diagnosed, and you need a supportive care partner who believes in you and is willing to go to the appointments with you and is willing to advocate for you, just as you might do for that care partner. Paul and I have been together since we were 14, so we spend a lot of time together, fell in love when we were young, and he and I both noticed some changes starting at around age 50 when I started menopause. Unfortunately, when we went to the doctor, I was always told it was anxiety, depression, and menopause, and basically just get over it. Here's some medication, go see a psychiatrist. If that doesn't work, go see somebody else. And it was demeaning, and it also was awful to know that you're pouring your heart and soul out to your primary care doctor, honestly saying something's wrong, and my husband could corroborate it, to only be told there's nothing wrong with you. So we'll do the same blood tests, we'll do MRIs, we'll do CAT scans, we'll do all these things, only to be told they're completely normal. It's just you. This is something you're going to have to learn to live with. So living with Alzheimer's, I would say, be aware of changes in a loved one. When they say they're noticing changes in themselves, listen, take notes, see if you're also seeing those same changes, or maybe you can elaborate and go to the doctor with them and say, yeah, that is happening, or I'm seeing it slightly different. But it needs a group effort to be believed. It also takes a lot of energy from both Paul and I to just get treatment. We spent a lot of money out of pocket because at that time, 8-10 years ago, if you wanted something done, it wasn't covered by insurance. So you had to take the initiative again to be willing to put out that information, because you needed almost a passport to your health, to your brain, to take from doctor to doctor to doctor, because they don't always coordinate their care with one another. But as long as you have it written down and you know what the next doctor is going to tell you, or the next doctor did tell you, you can go to the next meeting and be that much more involved and planning ahead. It's been an interesting journey.
Definitely an interesting journey. Some of the warning signs that we were able to recognize and witness is Tammy had some really extreme anxiety and anger, frustration, and it was not typical of Tammy at all. Tammy was by nature very gentle and compassionate, as she still is, but moments would flare, and it would be confusing because it just simply wasn't normal. They just, that's not how Tammy was. And then great sadness would come over her because she didn't mean to really respond that way or act that way or what have you. And of course, as not yet knowing I'm going to be a caretaker or this disease is even, upon us, the natural reaction is to be defensive as a spouse. And admittedly, you would try to defend whatever was said or whatever is going on. And that added confusion and that added concern for one of us. Fortunately, as Tammy mentioned, we've been together a very long time. So we have a great foundation and a great understanding of one another, and our level of compassion and true love for one another is pretty remarkable. We like to believe, and we do feel that. We have, great faith, so we are strong to look into our prayer and our spiritual leaders, and that part's been very helpful and beneficial. But again, touching back upon the warning signs as it was going on, Tammy started developing a twitch or involuntary movement, as they've classified it. And it just would get more intense. So she would shake in various places, almost much like a muscle spasm. And that was kind of strange because Tammy and I have been very healthy, active. We are involved in a lot of exercise process through life. We hike a lot. We swim. We ride bikes, mountain bikes. Tammy no longer. We're concerned about her safety, so it's been a decision that we both made that it's best not for her to do that. I don't know, what were some of the other symptoms that we experienced? Oh, sleeping. Tammy had and still is dealing with a very different sort of sleeping pattern. So she sleeps and takes naps sometimes a couple of hours a day, and sometimes a couple of times a day. Depends on how the day is for her. And then unfortunately, it's disturbed for the evening, the typical normal time that we would rest and sleep. Tammy's not sleeping well at all. And consequently, I don't sleep well as a result of that. But that's, those are some of the things that are going on. Tammy also early on would, and still does, she'll lose her phone frequently. We found a few remedies for that, but her phone, her glasses, her purse, those sorts of things will still occur. And again, those were evident early on, as they are still with us, though we are much more calm and patient about it because we recognize that's going to take place. So initially, it was more of a frustration for us because we just couldn't find it, and it's a necessity to have all those items for Tammy. So yeah, what else were you thinking?
I think as a person living with the disease, but also the care partner, you have to find workarounds. So for example, when I couldn't find my keys, Paul got a little, what do you call that? A stretchy chain that would hook to my keys, but then also hook to my purse. So even if I dropped the keys, it was still hooked to my purse, so I could put it back in my car. Same with my phone. You just find workarounds, much like you would with the toddler who can't find their shoes, who can't find their clothes. You know, you just learn to become a team in a different way. And, you know, my brain still works in some ways better than it ever has. I have found a voice that I never knew that I had. And I thank Alzheimer's for that, and the association for allowing me to exercise my voice, because I think that until this disease is believed and understood and treatment is researched, it's just going to progress. It's not going to be addressed. So I think that we all have to pay attention to the disease and look around at how many care facilities are being built around you. There is evidence that the disease is just going to become exponentially more prevalent. And I'm hoping having a voice, and my husband having a voice, that maybe something we say today might help you or someone you know in the future, or someone you love, to get treatment faster than a whole decade. I also think something as simple as starting at the age 50, a primary care doctor should be willing to give the one-page memory test. It's a simple test. It's identify these animals and what are these words. And I think had she done that when I turned 50, she would have seen some of these subtle changes that otherwise she missed. So I think they're just some simple things that we can help work with the medical community on. I was really relieved when I finally got the diagnosis. I knew when I had the beta amyloid PET scan, which we paid for out of our pocket again, because there is no health coverage insurance for it. I already knew what the answer was going to be. So on some level, I was relieved that I now had something concrete in front of me that I could take to the doctor appointments with me. But then I was also just really angry that I'm a nurse, was a nurse years ago, that my nursing background didn't help me get the care that I needed, that I was seeking, because I was just seemed to be too young for the disease. And so it took a lot of family support and friendship support to say, we're coming with you, Tam. We're going to take notes at all your doctor's appointments, and together we're going to be your team. We're going to be your advocates, and we're going to all work together. And just, we're going to help one another. We're going to stay committed to helping one another. And I think the Alzheimer's Association has been wonderful for allowing my family. Of a son who's in New York, he's in Chicago. Our other son is here in San Jose. But we can go on 24 hours a day at our own leisure. If we have specific questions, we can call people, and it's all very caring and compassionate. Yes, you believe that person on the other end of the line has a genuine interest in your story, and they can help guide you through this very stressful time. You know, my mom died in 1976 of pancreatic cancer, and at that time there were no oncologists and there were no cancer centers, and I remember her feeling left out. And this disease to some degree is a lot like that, but I see that the voices are changing their trajectory of treatment and bringing validation and help to the caregivers as well, because I didn't want Paul to be my caregiver. I was going to be his caregiver. And, you know, roles have reversed here a little bit. So we're just,
Well, our early on in life, our goal and our desire was to grow old together and care for one another. And so I think, you know, whether it's consciously, subconsciously, or by nature, we've always had that that desire. We knew, obviously, that's the evolution of life. And the interesting thing about that is, though we're entering that in our age, we didn't expect it to be this early in life, that we would have to change our path of and direction of how we live our golden years, if you will. It's hard for me to say that because I don't want to accept the golden years, but we're here. But it just comes at a very odd time and a very interesting time, but one in which we are strong and we will embrace. You know, selfishly, I always wanted to take care of Tammy, and Tammy always wanted to take care of me. So we would always have this, you know, kind of fun little, well, you're going to take care of me before I'm going to take care of you. And I finally conceded and wanted her to take care of me. But honestly, I embrace it. I want to take care of Tammy. She's taken care of me all my life. So we have great love for one another, and that helps us get motivated and very passionate about not only the care, but the methods in which we need to evolve and change and accept things that I am not even aware of, things that we will just morph into that next facet as this disease will progress. And we'll do it the best of our ability. The Alzheimer's Association, as Tammy has talked about a little bit, is really quite fascinating. They are very compassionate people. There is true love in their hearts. I don't know where they find the volunteers, but they certainly meet the criteria, each and every one of them that we've communicated with. And so we're grateful for that resource. Dr. Cohen was rather fascinating for me in that he's provided me with some hope, and with his slides and the knowledge just in the brief few minutes that he spoke, it was rather encouraging, things that I'm not yet aware of. So it gives us great hope. And I, by nature, like to think in terms of the opportunities to get better, to get well. And Tammy is right there as well. So that's our goal. That's our wish. That's our desire. Emotionally, it was, for me, hearing this, it was kind of disbelief at first, because the doctor gave me some false hope. I don't think intentionally. It was just my desire to only want to hear the hope. It doesn't mean, Tammy had the diagnosis confirmed by the beta amyloid CAT scan. And so, or PET scan, sorry, doctor. At any rate, when that was confirmed, he says, it doesn't mean you actually have the disease. And I think if you take this particular medicine, it will help stop the plaque growth, which is the contributing factor to this. And so I ran with that. I just thought, well, great, let's just take that medicine and you're going to be fine and life is going to go on. And it hasn't gone on the way I thought it should or would. Things have changed, definitely. But it was giving me that hope, whereas Tammy was very hurt and confused, I think might be a fair word. Maybe more me confused, but angry for sure with Tammy. And it was this this difficulty to get past. And we had we had a lot of emotional moments. There were layers of emotion as I started to finally recognize and accept. I don't know if denial was really the right word, but it was finally a time in which I had to accept the fact that, wait a minute, this is much more serious than just taking a pill and carrying on. And part of my fear of it is I just didn't have the knowledge Tammy had. Tammy is an RN, and she's always been my financial my medical counselor, if you will. Whenever I have a problem or a pain or what have you, which Tammy was able to at least come to my aid, and still does, by the way, and help me identify it and learn the medical terms, and which, you know, was difficult for me at times because it was just something that I didn't put a great emphasis on, whatever that problem might be. So having to learn that, having to be much more familiar with the terms, understanding, you know, this disease that I knew very little about. You know, it was an old person's disease, and we're not old in our minds, and so therefore it can't be a possibility. So learning that you know, a disease occurs at a very early age, and with some people, in Tammy's case is the case for her. So it's been a challenge for us in that sense. Yeah.
Mm-hmm.
What other emotions do you do?
I think one of the emotions I have and still have is that when somebody finds out about the disease, they'll say, well, you look okay. I'm not sure what they think I'm supposed to look like, but it's almost as if they don't believe that I had the diagnosis, or they would expect me to not be able to speak and take control of my life to the degree that I am. I'm just offering the suggestion that when you hear somebody has the disease Alzheimer's, you might just say, well, how does that feel to you? What is it like? Explain it to me. How can I help you? And I tell my friends, you know, the time might come where I won't remember you, and I will act like I don't know you, but just, I'll know in my heart, I'll know. Where my brain is perhaps going to misfire, my heart will never misfire. Just tell me a story, bring me pictures, remind me of all the fun we've had and the wonderful things that we did, and talk about my family and my friends, and just don't discount me, as I wouldn't discount you under the same circumstances. I believe everybody still has something to offer. My life is just being reworked. My method of communicating is going to change over the years, and I just have to learn to figure out how to change with it. So I would just say, keep talking to the people you love. They're listening, even if you don't think they are.
Very powerful. Thank you, Tammy and Paul. Thank you.
Sure.
You're welcome.
Thank you.
Thank you.
I'd like to bring everybody back, Dr. Cohen and Eva, and open it up. If anyone has any questions for any of our speakers for this evening. Again, you can type it either in the chat box or the Q&A. I actually have a question that someone had written me earlier. I believe this is for Dr. Cohen. In reference to over-the-counter supplements and curcumin, is it good to eat food with turmeric?
First, thank you guys so much for sharing the story and for highlighting so many really important things. For curcumin and turmeric, in my mind, that falls in the category of I am excited and hopeful for the future, but I have not yet seen anything that actually convinces me. So I tell people, well, first, people who have Alzheimer's and some other types of dementia often have a decreased sense of smell. And if you don't have the same appetite, it's hard to get good nutrition in. So if you like cumin, great. I think it tastes wonderful. So Especially if your loved one is not perhaps eating quite as well, then use more spices, garlic, onions, hot sauce, whatever. But in terms of prevention, if you enjoy it, eat it, because enjoying your food and enjoying life is important. And I am hopeful that in the future I can give you a clear answer, but I have not yet seen a study that convinces me that it is helpful.
Okay. Okay. Is doing crossword puzzles good for you? Does that help support your brain?
I guess also for me. So yes, any sort of mental activity, anything that is getting your brain active, happy, and engaged is great, as long as you like crossword puzzles. If crossword puzzles stress you out, then no. If you're going to be sitting staring at a puzzle for 5 hours and, drooling on the puzzle, then that's not helpful. If you like it and it's keeping your brain warm, then yes, but it's not like crossword puzzles are great and Sudoku is horrible. Something you like, something you enjoy, something that gets your brain moving.
Okay. I believe this is for you again, Dr. Cohen. How do you diagnose the different kinds of dementia, and are they treated differently?
Oh, the shortest answer I think I could possibly give to that, a lot of time talking to people, talking to their family member or friend or someone who knows them well, and taking a lot of time to talk about the memory and the mood changes and medical stuff and blood tests and pictures of the brain. And there's some things that are sort of the standard baseline, and then depending on what the individual person needs, you have to build off of that. I'm very fortunate at my center. I get to work with a giant team, and we're supported by New York State, so I have an almost unbelievable amount of time to spend with people, but it means I don't get to see people often, and we don't get to see as many people as we'd like. So that's why we're also just working on talking to and teaching primary care doctors and everyone else. But it's a lot of time and it's a lot of detail. And I am very hopeful that in the coming years we have blood tests for these things, so people can get me to stop talking so much.
You're too funny.
You're a great speaker. I keep talking.
And we have time for one more question. Tammy and Paul, are there any other tips you can give caregivers?
Well, I would say, as a recipient of his care, to allow him, like I said before, take care of himself. Go ride your bike. Let somebody else pamper him for a change. And also to ask friends to come stay with me if he's got to go somewhere and I'm not comfortable staying by myself. It's okay to ask for help. And we've come to find out people want to help. That's why they ask. They truly want to help. And so I think it's an honor for them, and they're happy that we trust them to take care of us.
And I would just say, be as patient as you possibly can. Don't take some of the comments personally. Recognize that it's probably just fear and being frightened, and it's the only way to communicate. So if you learn that early on, it can help you recognize, wait a minute, this isn't the Tammy. Tammy's scared right now. I've got to, take control of the situation to help her recognize we're going to be okay. We're not in a fearful moment. We'll get past this, or we can fix it, or what have you. That would be mine. And always, lots of love, lots of hugs, lots of cuddling, lots of care,
Lots of laughter.
Yeah, just like Eva had announced with her dad. So, yeah.
Great, thank you. So I want to thank everybody for joining us tonight, especially my presenters, Dr. Cohen, Eva, Tammy, and Paul. Thank you so much. I also want to thank my colleague, Christiane, who is, you can't see her, but she's on the back end, helping to bring this wonderful presentation to everybody today. If you'd like to learn more about the Kensington, again, folks, please feel free to call us, 914-390-0080, or you can go to our website, www.thekensingtonwhiteplains.com. Please be sure to stay until the very end. There will be a slide that will have information on our speakers. Thank you all so much, and have a really wonderful evening. Thank you.
Thank you.
Thank you.
Thank you. Bye-bye.
Bye.
Or how do you think it went?
I think you did really well.
Yeah.